Question 1. A nurse is caring for a client with a new prescription for warfarin. Which client education points are essential to include? Select all that apply. A. Avoid eating leafy green vegetables. B. Report any signs of unusual bleeding or bruising. C. Take the medication at the same time each day. D. Regular blood tests will be needed to monitor therapy. E. Increase intake of vitamin K-rich foods if a dose is missed. F. Use a soft bristle toothbrush and an electric razor. Answer. Report any signs of unusual bleeding or bruising. Take the medication at the same time each day. Regular blood tests will be needed to monitor therapy. Use a soft bristle toothbrush and an electric razor. This question tests understanding of essential client education for anticoagulation therapy with warfarin, emphasizing safety and adherence. Warfarin thins the blood, increasing the risk of bleeding, so reporting unusual bleeding or bruising and using a soft toothbrush and electric razor are crucial safety measures. Taking the medication at the same time daily promotes consistent therapeutic blood levels, and regular blood tests, like PT/INR, are necessary to monitor the medication's effectiveness and adjust dosages. Avoiding all leafy green vegetables is incorrect, as consistent intake is more important than avoidance, and increasing vitamin K-rich foods would counteract warfarin's effect. Remember to always prioritize safety and consistency when teaching about anticoagulants. Question 2. The nurse is assessing a client with fluid volume excess. Which clinical manifestations should the nurse expect to find? Select all that apply. A. Hypotension. B. Bounding pulse. C. Peripheral edema. D. Decreased urine output. E. Shortness of breath. F. Weight gain. Answer. Bounding pulse, peripheral edema, shortness of breath, weight gain. This question assesses the nurse's ability to recognize the classic signs of fluid volume excess, where the body retains too much fluid. The keywords fluid volume excess indicate an overloaded circulatory system. This overload leads to a bounding pulse due to increased circulating volume, peripheral edema as fluid shifts into interstitial spaces, shortness of breath from pulmonary congestion, and weight gain from the retained fluid. Hypotension and decreased urine output are typically signs of fluid volume deficit, not excess. Remember to associate fluid excess with too much fluid in the system causing swelling and respiratory distress. Question 3. A client with a new ileostomy is receiving discharge instructions. Which teaching points should the nurse include? Select all that apply. A. Empty the pouch when it is 1/3 to 1/2 full. B. Report any increase in watery stool output. C. Avoid foods high in fiber to prevent blockage. D. Increase fluid intake to prevent dehydration. E. Change the appliance every 2 to 3 days. F. Chew food thoroughly to prevent food blockage. Answer. Empty the pouch when it is 1/3 to 1/2 full. Increase fluid intake to prevent dehydration. Chew food thoroughly to prevent food blockage. This question focuses on critical discharge education for a client with a new ileostomy, emphasizing proper care and complication prevention. Emptying the pouch when it is 1/3 to 1/2 full prevents it from becoming too heavy and pulling away from the skin. Increasing fluid intake is vital because an ileostomy bypasses the large intestine, leading to significant fluid loss and a high risk of dehydration. Chewing food thoroughly prevents undigested food from causing a blockage in the stoma. An increase in watery stool output is normal for an ileostomy, not a cause for concern, and while avoiding excessive high-fiber foods initially is wise, total avoidance isn't necessary long-term. Changing the appliance every 5 to 7 days is generally recommended, not every 2 to 3 days, unless leakage occurs. Always prioritize teaching aimed at preventing common complications like dehydration and blockage. Question 4. The nurse is assessing a client experiencing a severe allergic reaction. Which actions should the nurse take immediately? Select all that apply. A. Administer diphenhydramine intravenously. B. Obtain a detailed allergy history from the client. C. Administer epinephrine intramuscularly. D. Elevate the client's legs and administer 4 fluids. E. Assess the client's airway and breathing. F. Prepare for intubation if respiratory distress worsens. Answer. Administer epinephrine intramuscularly, assess the client's airway and breathing, prepare for intubation if respiratory distress worsens, administer diphenhydramine intravenously, elevate the client's legs and administer 4 fluids. This question tests the nurse's immediate priorities in managing a severe allergic reaction, often called anaphylaxis, which is a medical emergency. The keyword immediately signals the need for rapid assessment and intervention. The priority is always airway, breathing, and circulation, ABCs, so assessing the airway and breathing is crucial, as is preparing for intubation if respiratory distress escalates. Epinephrine is the first-line medication for anaphylaxis and should be administered intramuscularly. Diphenhydramine, an antihistamine, and 4 fluids are supportive treatments to manage symptoms and support blood pressure. Obtaining a detailed allergy history is important but not the immediate priority during a severe reaction. Always remember the ABCs and rapid administration of epinephrine for anaphylaxis. Question 5. Which interventions are appropriate for a client diagnosed with deep vein thrombosis, DVT? Select all that apply. A. Encourage ambulation to prevent stasis. B. Administer prescribed anticoagulants. C. Apply warm, moist compresses to the affected extremity. D. Elevate the affected extremity. E. Massage the affected extremity vigorously. F. Monitor for signs of pulmonary embolism. Answer. Administer prescribed anticoagulants, apply warm, moist compresses to the affected extremity, elevate the affected extremity, monitor for signs of pulmonary embolism. This question assesses appropriate nursing interventions for a client with deep vein thrombosis, DVT, a condition involving a blood clot in a deep vein. The core concept is preventing clot dislodgement and managing symptoms. Administering anticoagulants is crucial to prevent clot enlargement and new clot formation. Elevating the affected extremity reduces edema and pain by promoting venous return. Applying warm, moist compresses can help reduce pain and inflammation. Monitoring for signs of pulmonary embolism, PE, such as sudden shortness of breath or chest pain, is critical because DVT is a major risk factor for PE. Ambulation is generally contraindicated initially due to the risk of dislodging the clot, and massaging the affected extremity is dangerous as it can dislodge the clot. Prioritize interventions that prevent complications and manage symptoms safely. Question 6. A client with a head injury develops increasing intracranial pressure, ICP. Which signs and symptoms would the nurse expect to observe? Select all that apply. A. Tachycardia. B. Decreased level of consciousness. C. Pupillary changes. D. Bradycardia. E. Projectile vomiting. F. Hypotension. Answer. Decreased level of consciousness, pupillary changes, bradycardia, projectile vomiting? This question targets the recognition of classic signs of increased intracranial pressure, ICP, a critical condition requiring prompt intervention. The keyword increasing intracranial pressure indicates pressure building inside the skull, which affects brain function. A decreased level of consciousness is often the earliest and most sensitive sign. Pupillary changes, such as sluggishness or unequal pupils, reflect pressure on cranial nerves. Bradycardia, slowed heart rate, and projectile vomiting are part of Cushing's triad: hypertension, bradycardia, irregular respirations, which indicates severe ICP. Tachycardia and hypotension are generally not associated with increased ICP and might indicate hypovolemia or shock. Always prioritize monitoring neurological status for any changes in clients with head injuries. Question 7. The nurse is providing education to a client with newly diagnosed type 2 diabetes mellitus. Which topics are essential to include in the teaching plan? Select all that apply. A. Importance of regular foot care. B. Monitoring blood glucose levels regularly. C. The need for annual eye exams. D. Daily vigorous exercise for at least 60 minutes. E. Symptoms of hypoglycemia and hyperglycemia. F. Importance of carbohydrate counting in meal planning. Answer. Importance of regular foot care, monitoring blood glucose levels regularly, the need for annual eye exams, symptoms of hypoglycemia and hyperglycemia, importance of carbohydrate counting in meal planning. This question assesses comprehensive education for a client with type 2 diabetes, focusing on disease management and complication prevention. The keywords newly diagnosed type 2 diabetes signify the need for foundational knowledge. Regular foot care is vital to prevent complications like neuropathy and poor circulation. Monitoring blood glucose levels is fundamental for managing the disease and making appropriate adjustments. Annual eye exams are crucial to screen for diabetic retinopathy, a common complication. Understanding the symptoms of both hypoglycemia, low blood sugar, and hyperglycemia, high blood sugar, empowers clients to manage acute situations. Carbohydrate counting is a key component of dietary management for maintaining stable blood glucose. While exercise is important, daily vigorous exercise for 60 minutes might be too intense for some clients. Regular, moderate activity is a more appropriate general recommendation. Focus on education that promotes self-management and early detection of complications. Question 8. A client is receiving a blood transfusion. Which findings would indicate an acute hemolytic transfusion reaction? Select all that apply. A. Bradycardia. B. Chills and fever. C. Hypotension. D. Flank pain. E. Jaundice. F. Hemoglobinuria. Answer. Chills and fever, hypotension, flank pain, hemoglobinuria. This question tests the nurse's ability to identify signs of an acute hemolytic transfusion reaction, a severe and potentially life-threatening complication of blood transfusions. The keyword acute hemolytic indicates an immediate immune response destroying the transfused red blood cells. Classic signs include chills, fever, flank pain, due to kidney involvement as hemoglobin is excreted, and hypotension resulting from circulatory collapse. Hemoglobinuria, hemoglobin in the urine, is a direct result of red blood cell destruction. Bradycardia and jaundice are not immediate signs of an acute hemolytic reaction. Jaundice might appear later due to increased bilirubin from red blood cell breakdown. Prompt recognition and intervention are critical in these situations. Question 9. The nurse is preparing to administer medications through a nasogastric (NG) tube. Which actions should the nurse take? Select all that apply. A. Verify tube placement before administration. B. Crush all medications into a fine powder. C. Flush the tube with 15 to 30 milliliters of water before and after each medication. D. Administer medications separately. E. Mix all medications together in one syringe. F. Elevate the head of the bed to at least 30 degrees. Answer. Verify tube placement before administration. Flush the tube with 15 to 30 milliliters of water before and after each medication. Administer medications separately. Elevate the head of the bed to at least 30 degrees. This question assesses the safe administration of medications via an NG tube, focusing on preventing complications and ensuring drug effectiveness. Nasogastric (NG) tube implies direct entry into the stomach. Verifying tube placement is paramount to prevent aspiration. Flushing the tube before and after each medication prevents clogging and ensures the full dose reaches the stomach. Administering medications separately prevents drug interactions and ensures proper delivery. Elevating the head of the bed minimizes the risk of aspiration. Not all medications can be crushed, and some are extended release, so crushing all is incorrect. Mixing all medications together is not recommended due to potential incompatibilities or clogging. Always prioritize safety and proper technique when administering medications via enteral tubes. Question 10. A client is experiencing manifestations of alcohol withdrawal. Which medications might the nurse anticipate administering? Select all that apply. A. Haloperidol. B. Lorazepam. C. Thiamine. D. Folic acid. E. Disulfiram. F. Naltrexone. Answer. Lorazepam, thiamine, folic acid. This question targets the pharmacological management of acute alcohol withdrawal syndrome, which is characterized by an overactive nervous system. The keywords alcohol withdrawal suggest interventions to stabilize the client and prevent serious complications. Benzodiazepines like lorazepam are the first-line treatment to reduce CNS hyperexcitability and prevent seizures. Thiamine, vitamin B1, and folic acid are crucial to prevent Wernicke-Korsakoff syndrome and other nutritional deficiencies common in chronic alcohol use. Haloperidol is an antipsychotic and might be used for severe agitation or hallucinations but is not a primary withdrawal medication. Disulfiram and naltrexone are used for long-term sobriety maintenance, not for acute withdrawal. Focus on medications that address acute symptoms and prevent neurological damage during withdrawal. Question 11. The nurse is reinforcing teaching for a client diagnosed with GERD, gastroesophageal reflux disease. Which lifestyle modifications should the nurse include? Select all that apply. A. Eat large meals right before bedtime. B. Elevate the head of the bed. C. Avoid trigger foods like fatty foods, caffeine, and chocolate. D. Wear tight-fitting clothing around the abdomen. E. Lose weight if overweight or obese. F. Stop smoking. Answer. Elevate the head of the bed, avoid trigger foods like fatty foods, caffeine, and chocolate, lose weight if overweight or obese, stop smoking. This question focuses on lifestyle modifications crucial for managing gastroesophageal reflux disease, GERD, where stomach acid frequently flows back into the esophagus. Elevating the head of the bed uses gravity to prevent reflux, especially at night. Avoiding trigger foods helps reduce acid production and esophageal irritation. Losing weight decreases intra-abdominal pressure, lessening the chance of reflux. Stopping smoking reduces lower esophageal sphincter relaxation and acid production. Eating large meals before bedtime and wearing tight clothing around the abdomen are detrimental as they increase abdominal pressure and reflux. Emphasize changes that reduce pressure, limit irritating substances, and promote gravity as protective factors. Question 12. A client is admitted with a suspected urinary tract infection, UTI. Which symptoms would the nurse expect to find? Select all that apply. A. Hematuria. B. Dysuria. C. Polyuria. D. Flank pain. E. Urinary urgency. F. Oliguria. Answer. Hematuria, dysuria, flank pain, urinary urgency. This question assesses the nurse's ability to recognize common signs and symptoms of a urinary tract infection, UTI, an infection anywhere in the urinary system. The keywords urinary tract infection point to localized irritation and inflammation. Hematuria, blood in the urine, dysuria, painful urination, and urinary urgency, sudden, compelling need to urinate, are classic symptoms of bladder involvement, cystitis. Flank pain suggests a possible upper UTI, pyelonephritis, involving the kidneys. Polyuria, frequent, large-volume urination, is more common in diabetes, while oliguria, decreased urine output, indicates kidney dysfunction or dehydration, not typically an uncomplicated UTI. Focus on symptoms that directly reflect irritation and infection within the urinary tract. Question 13. The nurse is caring for a client post-cardiac catheterization. Which interventions are appropriate for the nurse to perform? Select all that apply. A. Encourage early ambulation within 1 hour. B. Monitor for bleeding at the insertion site. C. Assess peripheral pulses distal to the insertion site. D. Keep the affected extremity straight. E. Administer oral analgesics for severe chest pain. F. Monitor vital signs frequently. Answer. Monitor for bleeding at the insertion site, assess peripheral pulses distal to the insertion site, keep the affected extremity straight, monitor vital signs frequently. This question focuses on essential nursing care for a client recovering from a cardiac catheterization, emphasizing monitoring for complications. Post-cardiac catheterization indicates a puncture site in a major artery, usually femoral or radial, that requires careful observation. Monitoring for bleeding at the insertion site is crucial due to the risk of hemorrhage. Assessing peripheral pulses distal to the insertion site helps detect arterial occlusion. Keeping the affected extremity straight minimizes stress on the puncture site and prevents bleeding or hematoma formation. Frequent vital sign monitoring can detect early changes indicating complications. Early ambulation is contraindicated. Typically, bed rest with the extremity straight is required for several hours. Severe chest pain after the procedure is a serious concern and would require immediate assessment, not just oral analgesics. Prioritize interventions that prevent and detect vascular complications. Question 14. A client with Addison's disease is experiencing an Addisonian crisis. Which clinical manifestations should the nurse expect? Select all that apply. A. Hypotension. B. Hyperglycemia. C. Hyponatremia. D. Hyperkalemia. E. Tachycardia. F. Weight gain. Answer. Hypotension, hyponatremia, hyperkalemia, tachycardia. This question tests the nurse's understanding of an Addisonian crisis, a life-threatening emergency caused by acute adrenal insufficiency. The keywords Addisonian crisis indicate a severe lack of adrenal hormones, primarily cortisol and aldosterone. This leads to hypotension and tachycardia as the body attempts to compensate for circulatory collapse. Due to aldosterone deficiency, sodium is excreted, causing hyponatremia, low sodium, and potassium is retained, causing hyperkalemia, high potassium. Hyperglycemia and weight gain are more associated with Cushing's syndrome or excess corticosteroids, not Addison's crisis. Remember that an Addisonian crisis causes a dramatic drop in blood pressure and electrolyte imbalances that can be fatal. Question 15. The nurse is caring for a client with a history of seizures. Which interventions should the nurse implement during a generalized tonic-clonic seizure? Select all that apply. A. Restrain the client's limbs to prevent injury. B. Place a tongue blade in the client's mouth. C. Clear the area of any hazards. D. Loosen tight clothing around the client's neck. E. Turn the client to their side. F. Administer 4 anti-seizure medication as prescribed. Answer. Clear the area of any hazards, loosen tight clothing around the client's neck, turn the client to their side, administer 4 anti-seizure medication as prescribed. This question assesses critical nursing actions during a generalized tonic-clonic seizure, focusing on client safety and airway management. The keywords tonic-clonic seizure describe a severe seizure with muscle rigidity and rhythmic jerking. Clearing the area of hazards prevents injury from involuntary movements. Loosening tight clothing around the neck ensures an open airway. Turning the client to their side, recovery position, prevents aspiration of saliva or vomitus. Administering 4 anti-seizure medication as prescribed helps to stop the seizure. Restraining limbs can cause injury, and placing anything in the mouth, like a tongue blade, is dangerous and can cause injury or airway obstruction. Always prioritize protecting the client from injury and maintaining a patent airway during a seizure. Question 16. A client is diagnosed with diverticulitis. Which dietary recommendations should the nurse provide during an acute flare-up? Select all that apply. A. Encourage a low-fiber diet. B. Increase fluid intake. C. Avoid foods with small seeds or nuts. D. Maintain a normal fiber intake. E. Consume a clear liquid diet initially. F. Encourage a high-fiber diet. Answer. Encourage a low-fiber diet, increase fluid intake, consume a clear liquid diet initially. This question addresses dietary management for a client experiencing an acute flare-up of diverticulitis, an inflammation of pouches in the colon. The key phrase, acute flare-up, indicates the need for bowel rest to reduce inflammation. Initially, a clear liquid diet is recommended to minimize bowel stimulation. As symptoms improve, a low-fiber diet is encouraged to reduce stool bulk and irritation. Increasing fluid intake is always important to prevent dehydration and constipation. Avoiding seeds and nuts is generally recommended for prevention but not the immediate priority during an acute flare-up. High fiber or normal fiber intake would exacerbate symptoms during an acute phase. Remember that during an acute flare-up, the goal is to rest the bowel, moving from liquids to low-fiber foods. Question 17. The nurse is educating a client about heart failure management. Which statements indicate effective client understanding? Select all that apply. A. I will weigh myself daily and report any significant changes. B. I should limit my sodium intake to prevent fluid retention. C. I can stop taking my medications if I feel better. D. I need to report any new or worsening shortness of breath. E. I should call my doctor if my ankles start to swell more. If. I will avoid all physical activity to save energy. Answer. I will weigh myself daily and report any significant changes. I should limit my sodium intake to prevent fluid retention. I need to report any new or worsening shortness of breath. I should call my doctor if my ankles start to swell more. This question assesses a client's understanding of self-management strategies for heart failure, a chronic condition where the heart cannot pump enough blood. Daily weight monitoring and reporting significant changes are crucial for detecting fluid retention early. Limiting sodium intake helps prevent fluid buildup. Reporting new or worsening shortness of breath or increased ankle swelling are essential because these indicate fluid overload or worsening heart failure. Stopping medications is incorrect, as heart failure requires continuous management. Avoiding all physical activity is also incorrect. Regular, moderate activity is often encouraged to improve cardiac function, though vigorous exercise might be contraindicated. Emphasize self-monitoring and adherence to medication and lifestyle changes. Question 18. A nurse is caring for a client with a full-thickness burn injury. Which interventions are appropriate for the nurse to include in the plan of care? Select all that apply. A. Administer opioid analgesics for pain management. B. Monitor for signs of infection. C. Apply ice directly to the burn wound. D. Maintain strict asepsis during wound care. E. Monitor fluid and electrolyte balance. F. Encourage a low-protein diet to prevent kidney overload. Answer. Administer opioid analgesics for pain management, monitor for signs of infection, maintain strict asepsis during wound care, monitor fluid and electrolyte balance. This question focuses on comprehensive care for a client with a full-thickness burn, which destroys all layers of skin. Full-thickness burn indicates severe tissue damage and a high risk of complications. Pain management with opioid analgesics is essential due to the severity of the injury. Burn wounds are highly susceptible to infection, so monitoring for signs of infection and maintaining strict asepsis during wound care are paramount. Large fluid shifts occur in burn injuries, making monitoring fluid and electrolyte balance critical. Applying ice directly to a severe burn is contraindicated as it can cause further tissue damage and hypothermia. A low-protein diet is incorrect. Clients with burns need a high-protein, high-calorie diet to support healing. Always prioritize pain control, infection prevention, and fluid balance in burn care. Question 19. The nurse is assessing a client for potential complications of immobility. Which findings would be concerning? Select all that apply. A. Increased muscle strength. B. Decreased appetite. C. Reddened area on the sacrum. D. Clear lung sounds. E. Decreased bowel sounds. F. Crackles in the lung bases. Answer. Decreased appetite, reddened area on the sacrum, decreased bowel sounds, crackles in the lung bases. This question assesses the nurse's ability to identify complications arising from immobility, a common issue in hospitalized clients. The keyword immobility implies reduced activity, leading to various systemic problems. Decreased appetite, reddened areas on the sacrum, indicating pressure injury risk, decreased bowel sounds, suggesting constipation, and crackles in the lung bases, indicating atelectasis or pneumoniae, are all concerning complications. Increased muscle strength is a positive finding, not a complication of immobility. Clear lung sounds are a normal, desired finding. Always be vigilant for skin breakdown, respiratory issues, GI sluggishness, and nutritional deficits in immobilized clients. Question 20. A client with a new colostomy requires discharge teaching. Which information should the nurse prioritize? Select all that apply. A. Signs and symptoms of stoma complications. B. How to change the ostomy pouch. C. Dietary restrictions for life. D. Where to purchase ostomy supplies. E. Importance of adequate fluid intake. F. How to irrigate the colostomy. Answer. Signs and symptoms of stoma complications, how to change the ostomy pouch, where to purchase ostomy supplies, importance of adequate fluid intake, how to irrigate the colostomy. This question focuses on essential discharge teaching for a client with a new colostomy, ensuring they can safely manage their stoma at home. New colostomy means the client needs comprehensive instruction for self-care. Teaching signs and symptoms of complications like infection or necrosis empowers the client to seek help when needed. Demonstrating how to change the ostomy pouch is a fundamental skill for independent living. Knowing where to purchase supplies ensures continuity of care. Adequate fluid intake is important for overall health and to prevent dehydration, especially with an ostomy. Teaching how to irrigate the colostomy, if indicated, helps establish a regular bowel pattern. While dietary guidance is important, dietary restrictions for life is an oversimplification. Many clients can eventually return to a varied diet. Prioritize practical skills, complication recognition, and resource provision for successful self-management. Question 21. The nurse is preparing a client for a lumbar puncture. Which nursing actions are appropriate? Select all that apply. A. Obtain informed consent from the client. B. Position the client supine with legs extended. C. Assist the client into a fetal position or leaning forward. D. Explain that a headache is a common post-procedure complication. E. Encourage fluid restriction after the procedure. F. Ensure the client empties their bladder prior to the procedure. Answer. Obtain informed consent from the client. Assist the client into a fetal position or leaning forward. Explain that a headache is a common post-procedure complication. Ensure the client empties their bladder prior to the procedure. This question assesses the nurse's knowledge of pre- and post-procedure care for a lumbar puncture, a diagnostic procedure involving the collection of cerebrospinal fluid. Obtaining informed consent is always required for invasive procedures. Assisting the client into a fetal position or leaning forward helps separate the vertebrae, making needle insertion easier. Explaining that a headache is a common post-procedure complication helps prepare the client and manage expectations. Ensuring the client empties their bladder before the procedure increases comfort and prevents accidental bladder puncture. Positioning the client supine with legs extended is incorrect. This closes the vertebral spaces. Encouraging fluid restriction is incorrect. Increased fluid intake is often advised post-procedure to reduce the risk of headache. Focus on client comfort, safety, and managing expectations related to the procedure. Question 22. A client with osteoporosis is receiving education on disease management. Which statements indicate effective client understanding? Select all that apply. A. I should avoid weight-bearing exercises to protect my bones. B. I will increase my intake of calcium and vitamin D-rich foods. C. I should incorporate regular weight-bearing exercises into my routine. D. I need to take my bisphosphonate medication with food to prevent stomach upset. E. I will be careful to avoid falls at home. F. Smoking has no impact on my bone density. Answer. I will increase my intake of calcium and vitamin D-rich foods. I should incorporate regular weight-bearing exercises into my routine. I will be careful to avoid falls at home. This question evaluates a client's understanding of managing osteoporosis, a condition characterized by brittle bones and increased fracture risk. Osteoporosis highlights the need for interventions to strengthen bones and prevent fractures. Increasing calcium and vitamin D intake is crucial for bone health. Regular weight-bearing exercises, such as walking, help to build and maintain bone density. Avoiding falls is paramount to prevent fractures, which are a major complication of osteoporosis. Avoiding weight-bearing exercises would worsen bone density. Bisphosphonate medications should typically be taken on an empty stomach with a full glass of water, and sitting upright for at least 30 to 60 minutes to prevent esophageal irritation. Smoking significantly impacts bone density negatively, so quitting is essential. Focus on teaching that promotes bone strength and fall prevention. Question 23. The nurse is monitoring a client who received too much insulin and is now hypoglycemic. Which findings would the nurse expect to observe? Select all that apply. A. Warm, dry skin. B. Shakiness or tremors. C. Confusion. D. Bradycardia. E. Sweating. F. Headache. Answer. Shakiness or tremors, confusion, sweating, headache. This question tests the nurse's ability to recognize the signs of hypoglycemia, low blood sugar, particularly in a client who received too much insulin. The phrase, too much insulin and is now hypoglycemic, directly points to a lack of glucose for the brain and an adrenergic response. Shakiness, tremors, sweating, and headache are common adrenergic symptoms, the body's fight or flight response to low sugar. Confusion is a neuroglycopenic symptom, meaning the brain isn't getting enough glucose. Warm, dry skin is a sign of hyperglycemia. Bradycardia is incorrect. Tachycardia is more likely as the body tries to compensate. Always be vigilant for these rapid onset symptoms of low blood sugar. Question 24. A client with chronic kidney disease, CKD, is receiving hemodialysis. Which interventions are appropriate for the nurse to include in the plan of care? Select all that apply. A. Administer antihypertensive medications before dialysis. B. Monitor for a thrill and bruit over the AV fistula/graft. C. Restrict fluid intake. D. Assess for signs of disequilibrium syndrome. E. Encourage a high-protein diet. F. Monitor blood pressure every 4 hours post-dialysis. Answer. Monitor for a thrill and bruit over the AV fistula/graft, restrict fluid intake, assess for signs of disequilibrium syndrome, monitor blood pressure every 4 hours post-dialysis. This question focuses on essential nursing care for a client with chronic kidney disease, CKD, undergoing hemodialysis, emphasizing monitoring and complication prevention. The keywords chronic kidney disease and hemodialysis indicate severe kidney impairment and the need for artificial kidney function. Monitoring for a thrill and bruit over the AV fistula/graft confirms its patency, which is vital for dialysis access. Restricting fluid intake is crucial to prevent fluid overload between dialysis sessions. Assessing for disequilibrium syndrome, a rapid fluid and electrolyte shift during or after dialysis, is important due to its neurological symptoms. Monitoring blood pressure post-dialysis helps detect hypotension, a common complication. Antihypertensive medications are often held before dialysis to prevent hypotension. A high-protein diet is generally not encouraged for CKD clients, as protein breakdown products are difficult for compromised kidneys to excrete. However, protein needs may increase during dialysis due to loss. Focus on maintaining vascular access, fluid balance, and monitoring for acute complications. Question 25. The nurse is teaching a client about preventing sexually transmitted infections, STIs. Which methods should the nurse include in the education? Select all that apply. A. Consistent and correct use of condoms. B. Regular douching after intercourse. C. Having only one sexual partner who is also monogamous and tested. D. Abstinence from sexual activity. E. Relying on oral contraceptives for STI prevention. F. Routine STI screening. Answer. Consistent and correct use of condoms, having only one sexual partner who is also monogamous and tested, abstinence from sexual activity, routine STI screening. This question assesses knowledge of effective strategies for preventing sexually transmitted infections, STIs, emphasizing safe sexual practices. The core concept is reducing exposure and transmission. Consistent and correct use of condoms creates a physical barrier to transmission. Having a mutually monogamous relationship with a tested partner significantly reduces risk. Abstinence is the most effective method for preventing STIs. Routine STI screening helps detect infections early, allowing for treatment and preventing further spread. Douching can disrupt natural vaginal flora and increase infection risk, not prevent STIs. Oral contraceptives prevent pregnancy but offer no protection against STIs. Always prioritize education on barrier methods, informed partner choices, and regular screening for STI prevention. Question 26. A client with a spinal cord injury at the T6 level develops autonomic dysreflexia. Which signs and symptoms should the nurse anticipate? Select all that apply. A. Bradycardia. B. Sudden, severe headache. C. Hypotension. D. Flushing above the level of injury. E. Profuse sweating above the level of injury. F. Nasal congestion. Answer. Bradycardia, sudden, severe headache, flushing above the level of injury, profuse sweating above the level of injury, nasal congestion. This question tests the nurse's ability to recognize the critical signs and symptoms of autonomic dysreflexia, a life-threatening emergency in clients with spinal cord injuries above T6. The keywords spinal cord injury at T6 and autonomic dysreflexia signal an exaggerated sympathetic response to noxious stimuli below the injury. This results in a sudden, severe headache, flushing and profuse sweating above the level of injury, and nasal congestion due to vasodilation. A compensatory parasympathetic response causes bradycardia. Hypertension, not hypotension, is a hallmark of autonomic dysreflexia below the level of injury. Prompt identification and removal of the trigger are crucial to prevent complications like stroke. Question 27. The nurse is caring for a client with hyperthyroidism. Which clinical manifestations should the nurse expect to observe? Select all that apply. A. Weight gain. B. Heat intolerance. C. Constipation. D. Exophthalmos. E. Tachycardia. F. Diarrhea. Answer. Heat intolerance, exophthalmos, tachycardia, diarrhea. This question assesses the nurse's recognition of common clinical manifestations of hyperthyroidism, a condition characterized by an overactive thyroid gland. The keyword hyperthyroidism indicates an excess of thyroid hormones, leading to a hypermetabolic state. This causes heat intolerance, rapid heart rate, tachycardia, and increased bowel movements, diarrhea. Exophthalmos, or bulging eyes, is a classic sign associated with Graves' disease, a common cause of hyperthyroidism. Weight gain and constipation are typically associated with hypothyroidism. Remember that hyperthyroidism speeds everything up in the body. Question 28. A client is prescribed digoxin for heart failure. Which teaching points are crucial for the nurse to include? Select all that apply. A. Take your pulse daily and report if it is below 60 beats per minute. B. Report any vision changes, especially yellow-green halos. C. Increase potassium-rich foods in your diet. D. Take a double dose if you miss a dose. E. Avoid antacids within 2 hours of taking digoxin. If digoxin will cure your heart failure. Answer. Take your pulse daily and report if it is below 60 beats per minute. Report any vision changes, especially yellow-green halos. Avoid antacids within 2 hours of taking digoxin. This question targets essential client education for digoxin, a cardiac glycoside used to improve heart contraction in heart failure. The concept is safe medication administration and toxicity prevention. Digoxin slows the heart rate, so clients must take their pulse daily and report bradycardia, below 60 bpm, to prevent toxicity. Vision changes, particularly yellow-green halos, are classic signs of digoxin toxicity. Antacids can interfere with digoxin absorption, so they should be taken at least 2 hours apart. Digoxin does not cure heart failure but manages symptoms. Missing a dose should not be compensated by a double dose. While hypokalemia can increase digoxin toxicity, simply increasing potassium-rich foods is a dietary change and doesn't replace careful monitoring and, if needed, potassium supplements. Focus on safety, monitoring for toxicity, and proper administration. Question 29. The nurse is caring for a client with severe depression. Which nursing interventions are appropriate for promoting safety and well-being? Select all that apply. A. Allow the client to spend unlimited time alone to process feelings. B. Encourage participation in group activities. C. Assess for suicidal ideation regularly. D. Remove all potentially harmful objects from the client's environment. E. Establish a therapeutic relationship with the client. If. Monitor medication adherence and side effects. Answer. Encourage participation in group activities, assess for suicidal ideation regularly, remove all potentially harmful objects from the client's environment, establish a therapeutic relationship with the client, monitor medication adherence and side effects. This question focuses on comprehensive nursing care for a client with severe depression, prioritizing safety and therapeutic engagement. Severe depression indicates a high risk for self-harm and withdrawal. Assessing for suicidal ideation regularly is crucial due to the increased risk. Removing harmful objects directly addresses safety. Establishing a therapeutic relationship provides trust and a supportive environment. Encouraging group activities helps combat isolation and promotes social interaction. Monitoring medication adherence and side effects is essential for effective treatment. Allowing unlimited time alone can increase isolation and suicidal thoughts, and is generally not recommended in severe depression due to safety concerns. Always prioritize safety, engagement, and consistent monitoring in clients with severe depression. Question 30. A client is experiencing manifestations of a fractured hip. Which signs and symptoms should the nurse expect to observe? Select all that apply. A. Shortening of the affected leg. B. Internal rotation of the affected leg. C. Severe pain in the hip or groin. D. Edema and bruising around the hip. E. Inability to bear weight on the affected leg. F. Increased range of motion in the hip. Answer: shortening of the affected leg, severe pain in the hip or groin, edema and bruising around the hip, inability to bear weight on the affected leg. This question assesses the nurse's ability to recognize the classic signs and symptoms of a fractured hip, a common injury, especially in older adults. The keywords fractured hip point to significant structural damage. Shortening of the affected leg, severe pain in the hip or groin, edema and bruising around the hip, and an inability to bear weight are all hallmark signs. The leg is typically externally rotated, not internally, due to muscle spasm and bone displacement. Increased range of motion would be incorrect, as movement is limited and painful. Focus on the observable physical changes and functional loss associated with a hip fracture. Question 31. The nurse is preparing to administer total parenteral nutrition, TPN, to a client. Which actions are essential for the nurse to take? Select all that apply. A. Administer TPN through a peripheral 4 line. B. Verify the TPN solution with another nurse. C. Monitor blood glucose levels regularly. D. Change the TPN tubing and dressing daily. E. Administer TPN at a rapid rate to prevent dehydration. F. Use an infusion pump for administration. Answer: verify the TPN solution with another nurse, monitor blood glucose levels regularly, change the TPN tubing and dressing daily, use an infusion pump for administration. This question focuses on the safe administration of total parenteral nutrition, TPN, a highly concentrated intravenous solution used for nutritional support. TPN is a high-risk medication, so verification with another nurse is crucial to prevent errors. Regular blood glucose monitoring is essential due to the high dextrose content. Changing the TPN tubing and central line dressing daily reduces the risk of infection. Using an infusion pump is mandatory to ensure a precise and consistent delivery rate, preventing rapid fluid shifts and hyperglycemia. TPN is administered via a central 4 line due to its hypertonicity, not a peripheral 4. Administering TPN at a rapid rate can cause fluid overload and severe hyperglycemia. Always prioritize patient safety through meticulous verification, monitoring, and controlled administration. Question 32. A nurse is caring for a client who is experiencing a manic episode. Which nursing interventions are appropriate for this client? Select all that apply. A. Provide a quiet, low-stimulation environment. B. Engage the client in lengthy, complex discussions. C. Offer frequent, high-calorie, nutritious snacks. D. Set clear, consistent limits on behavior. E. Allow the client to skip meals if they are too busy. F. Provide opportunities for physical activity. Answer: provide a quiet, low-stimulation environment, offer frequent, high-calorie, nutritious snacks, set clear, consistent limits on behavior, provide opportunities for physical activity. This question assesses appropriate nursing interventions for a client experiencing a manic episode, a period of abnormally elevated or irritable mood, often with increased energy. The keywords manic episode imply a need for interventions that manage hyperactivity and provide a safe, structured environment. Providing a quiet, low-stimulation environment helps reduce agitation. Offering frequent, high-calorie, nutritious snacks addresses the client's increased metabolic rate and potential for poor nutrition due to hyperactivity. Setting clear, consistent limits helps provide structure and manage impulsive behavior. Providing opportunities for physical activity can help channel excess energy. Engaging in lengthy, complex discussions is counterproductive due to the client's shortened attention span. Allowing the client to skip meals would exacerbate nutritional deficits. Prioritize safety, structure, and meeting basic physical needs. Question 33. The nurse is providing discharge teaching for a client with iron deficiency anemia. Which dietary recommendations should the nurse include? Select all that apply. A. Limit intake of vitamin C-rich foods. B. Increase consumption of red meat and poultry. C. Include fortified cereals and breads. D. Drink coffee or tea with iron supplements. E. Avoid cooking in cast iron pans. E. Consume dark leafy green vegetables. Answer. Increase consumption of red meat and poultry, include fortified cereals and breads, consume dark leafy green vegetables. This question focuses on dietary education for a client with iron deficiency anemia, emphasizing foods that are good sources of iron. The keyword iron deficiency anemia means the client needs to increase iron absorption and intake. Red meat and poultry are excellent sources of heme iron, which is highly absorbable. Fortified cereals and breads provide non-heme iron. Dark leafy green vegetables also provide non-heme iron. Vitamin C enhances iron absorption, so limiting it would be incorrect. Coffee and tea contain tannins that can inhibit iron absorption, so they should be avoided when taking supplements or iron-rich meals. Cooking in cast iron pans can actually increase iron content in food. Teach clients to pair iron-rich foods with vitamin C for optimal absorption. Question 34. A nurse is assessing a newborn in the immediate postpartum period. Which findings would be considered normal? Select all that apply. A. Acrocyanosis. B. Jaundice within the first 24 hours. C. Heart rate 120 to 160 beats/min. D. Respiratory rate 30 to 60 breaths/min. E. Presence of Epstein's pearls. E. Single umbilical artery. Answer. Acrocyanosis, heart rate 120 to 160 beats/min, respiratory rate 30 to 60 breaths/min, presence of Epstein's pearls. This question assesses knowledge of normal physiological findings in a newborn immediately after birth. Immediate postpartum newborn indicates the early transition period. Acrocyanosis, bluish discoloration of hands and feet, is normal for the first 24 to 48 hours. A heart rate between 120 to 160 beats/min and a respiratory rate between 30 to 60 breaths/min are normal ranges for newborns. Epstein's pearls, small white cysts on the gums or roof of the mouth, are common and benign. Jaundice within the first 24 hours is always pathological and requires investigation, not normal. A single umbilical artery is an abnormal finding, usually meaning a two-vessel cord, and can be associated with renal or cardiac anomalies. Focus on differentiating between transient normal findings and those that require further assessment. Question 35. The nurse is providing care for a client with a nasogastric (NG) tube connected to low intermittent suction. Which actions are appropriate? Select all that apply. A. Irrigate the NG tube with normal saline as ordered. B. Maintain the client in a supine position to prevent tube displacement. C. Monitor for signs of fluid and electrolyte imbalance. D. Auscultate bowel sounds every 8 hours. E. Clamp the NG tube for 30 minutes after medication administration. E. Assess the client's abdomen for distension. Answer. Irrigate the NG tube with normal saline as ordered. Monitor for signs of fluid and electrolyte imbalance. Auscultate bowel sounds every 8 hours. Assess the client's abdomen for distension. This question focuses on appropriate nursing care for a client with an NG tube on low intermittent suction, emphasizing proper function and complication monitoring. The NG tube with suction implies a need to decompress the stomach. Irrigating the NG tube with normal saline as ordered prevents clogging and maintains patency. Monitoring for fluid and electrolyte imbalance is crucial because suction removes gastric fluids rich in electrolytes. Auscultating bowel sounds every 8 hours and assessing for abdominal distension helps evaluate bowel function and potential complications. The client should be maintained in a semi-Fowler's position or higher to prevent aspiration, not supine. The instruction to clamp for 30 minutes after medication administration is generally for gravity drainage, not for continuous suction, and should only be done per specific orders. Focus on maintaining tube patency, monitoring for complications, and client comfort. Question 36. A client is receiving warfarin therapy. Which factors can increase the risk of bleeding in this client? Select all that apply. A. Concurrent use of aspirin. B. High intake of vitamin K-rich foods. C. Liver disease. D. Consumption of alcohol. E. Concurrent use of acetaminophen. F. Recent gastrointestinal bleed. Answer. Concurrent use of aspirin, liver disease, consumption of alcohol, recent gastrointestinal bleed. This question assesses the nurse's understanding of factors that increase bleeding risk in a client on warfarin, an anticoagulant. Warfarin therapy indicates the client's blood is already thinned, making them prone to bleeding. Concurrent use of aspirin or other NSAIDs significantly increases bleeding risk due to their antiplatelet effects. Liver disease impairs the liver's ability to produce clotting factors, further increasing bleeding risk. Alcohol consumption can inhibit warfarin metabolism and interfere with clotting factor production. A recent gastrointestinal bleed indicates a pre-existing bleeding site, making further bleeding more likely. High intake of vitamin K-rich foods would decrease warfarin's effect, increasing clotting risk. Acetaminophen at normal doses typically does not significantly increase bleeding risk with warfarin, although very high doses could. Focus on drug-drug interactions, comorbidities, and existing bleeding risks. Question 37. The nurse is assessing a client for signs of hypokalemia. Which findings should the nurse expect? Select all that apply. A. Muscle weakness and cramps. B. Tall, peak T waves on ECG. C. Paresthesias. D. Constipation. E. Hyperactive bowel sounds. F. Shallow respirations. Answer. Muscle weakness and cramps, paresthesias, constipation, shallow respirations. This question tests the nurse's ability to recognize the clinical manifestations of hypokalemia, a condition of low potassium levels in the blood. Hypokalemia affects nerve and muscle function, leading to decreased excitability. This manifests as muscle weakness and cramps, paresthesias, tingling or numbness, constipation due to decreased gastrointestinal motility, and shallow respirations from respiratory muscle weakness. Tall, peak T waves on an ECG are characteristic of hyperkalemia. Hyperactive bowel sounds are not typical. Hypoactive bowel sounds, ileus, are more common. Remember that hypokalemia slows things down, especially in muscles and the GI tract. Question 38. A nurse is providing education to a client on a low-sodium diet. Which food choices should the nurse instruct the client to limit or avoid? Select all that apply. A. Fresh fruits and vegetables. B. Canned soups. C. Processed meats like bacon and sausage. D. Unsalted nuts. E. Pickles and olives. F. Whole grain pasta. Answer. Canned soups, processed meats like bacon and sausage, pickles and olives. This question assesses knowledge of a low-sodium diet, a common therapeutic diet for conditions like hypertension or heart failure. The keyword low-sodium diet means avoiding foods with high salt content. Canned soups, processed meats, like bacon and sausage, and pickled items, like pickles and olives, are typically very high in sodium. Fresh fruits, vegetables, unsalted nuts, and whole grain pasta are generally low in sodium and good choices. Focus on teaching clients to avoid processed, preserved, and restaurant foods, and to choose fresh, unprocessed options. Question 39. The nurse is caring for a client with a history of recurrent urinary tract infections, UTIs. Which teaching points are appropriate for prevention? Select all that apply. A. Wipe from front to back after toileting. B. Urinate after sexual intercourse. C. Avoid synthetic underwear, wear cotton instead. D. Take prophylactic antibiotics daily for life. E. Limit fluid intake to reduce urinary frequency. F. Consume cranberry juice regularly. Answer. Wipe from front to back after toileting, urinate after sexual intercourse, avoid synthetic underwear, wear cotton instead, consume cranberry juice regularly. This question addresses preventive measures for recurrent urinary tract infections, UTIs, focusing on hygiene and lifestyle. Wiping from front to back prevents bacteria from the anal area from entering the urethra. Urinating after sexual intercourse helps flush out bacteria that may have entered the urethra. Wearing cotton underwear allows for better airflow, reducing moisture and bacterial growth, compared to synthetic materials. Regularly consuming cranberry juice may help prevent bacteria from adhering to the bladder wall. Taking prophylactic antibiotics daily for life is not a standard recommendation for all clients and carries risks like antibiotic resistance. Limiting fluid intake is incorrect. Adequate fluid intake helps flush bacteria from the urinary tract. Emphasize modifiable behaviors that reduce bacterial entry and promote flushing. Question 40. The nurse is assessing a client with acute glomerulonephritis. Which findings should the nurse expect to observe? Select all that apply. A. Hypotension. B. Periorbital edema. C. Hematuria. D. Hypertension. E. Frothy urine. F. Oliguria. Answer. Periorbital edema, hematuria, hypertension, oliguria. This question assesses the nurse's ability to recognize the clinical manifestations of acute glomerulonephritis, an inflammatory kidney disorder. The keywords acute glomerulonephritis indicate inflammation of the kidney's filtering units. This inflammation leads to periorbital edema, swelling around the eyes, and hypertension due to fluid retention and impaired kidney function. Hematuria, blood in the urine, is common, often appearing as tea-colored or smoky urine, and oliguria, decreased urine output, occurs due to reduced glomerular filtration. Frothy urine typically indicates proteinuria, excess protein in urine, while hypotension is not a common finding in acute glomerulonephritis. Focus on the triad of edema, hypertension, and hematuria/oliguria. Question 41. The nurse is educating a client newly diagnosed with type 1 diabetes mellitus. Which information is essential for the nurse to include? Select all that apply. A. The importance of regular insulin injections. B. That a strict carbohydrate-free diet is required. C. How to monitor blood glucose levels. D. Signs and symptoms of hypoglycemia. E. The condition is curable with lifestyle changes. F. The need for annual lipid panel checks. Answer. The importance of regular insulin injections, how to monitor blood glucose levels, signs and symptoms of hypoglycemia, the need for annual lipid panel checks. This question focuses on critical education for a client newly diagnosed with type 1 diabetes mellitus, emphasizing lifelong management. Type 1 diabetes means the pancreas produces little to no insulin. Regular insulin injections are absolutely essential because the body cannot produce its own. Clients must learn how to monitor their blood glucose levels to guide insulin dosing. Understanding the signs and symptoms of hypoglycemia, low blood sugar, is crucial for safety. Annual lipid panel checks are important due to the increased risk of cardiovascular disease in people with diabetes. A strict carbohydrate-free diet is not required. Instead, carbohydrate counting and consistent intake are key. Type 1 diabetes is a chronic, autoimmune condition and is not curable with lifestyle changes. Prioritize teaching for immediate safety and long-term complication prevention. Question 42. A nurse is caring for a client with a suspected opioid overdose. Which clinical manifestations should the nurse anticipate? Select all that apply. A. Pinpoint pupils. B. Tachypnea. C. Hypertension. D. Bradypnea. E. Altered mental status. F. Warm, flushed skin. Answer. Pinpoint pupils, bradypnea, altered mental status. This question assesses the nurse's ability to recognize the classic signs of an opioid overdose, a medical emergency that depresses the central nervous system. The keywords opioid overdose point to respiratory depression and altered consciousness. Pinpoint pupils, bradypnea, slowed breathing, and altered mental status, ranging from drowsiness to unresponsiveness, are hallmark signs. Tachypnea and hypertension are generally not seen, rather, blood pressure and heart rate may be low. Warm, flushed skin is not typical, skin may be cool and clammy. Immediate intervention, often with naloxone, is critical to reverse respiratory depression. Focus on the triad of pinpoint pupils, respiratory depression, and decreased level of consciousness. Question 43. The nurse is providing education to the parents of a child with cystic fibrosis, CF. Which topics are important to include in the teaching plan? Select all that apply. A. The importance of a low-calorie, low-fat diet. B. Techniques for chest physiotherapy. C. Signs and symptoms of respiratory infection. D. Administration of pancreatic enzymes with meals. E. Genetic counseling for future pregnancies. F. Limiting physical activity to conserve energy. Answer. Techniques for chest physiotherapy, signs and symptoms of respiratory infection, administration of pancreatic enzymes with meals, genetic counseling for future pregnancies. This question focuses on comprehensive education for parents of a child with cystic fibrosis, CF, a genetic disorder primarily affecting the lungs and digestive system. Cystic fibrosis implies issues with thick mucus production. Teaching chest physiotherapy techniques is crucial for clearing mucus from the airways and preventing infections. Parents must recognize signs and symptoms of respiratory infection, a frequent complication. Administration of pancreatic enzymes with meals is essential to aid digestion and nutrient absorption due to pancreatic insufficiency. Genetic counseling is important because CF is an inherited disorder. A low-calorie, low-fat diet is incorrect. Children with CF require a high-calorie, high-fat, high-protein diet to meet their increased metabolic demands. Limiting physical activity is also incorrect. Exercise is encouraged to promote lung health. Emphasize interventions that support respiratory function, nutrition, and informed family planning. Question 44. A client is diagnosed with a urinary tract infection, UTI, and is prescribed antibiotics. Which teaching points are crucial for the nurse to include? Select all that apply. A. Stop the antibiotic once symptoms improve. B. Complete the entire course of antibiotics. C. Increase fluid intake, especially water. D. Avoid cranberry products while on antibiotics. E. Report any allergic reactions or severe side effects. F. Take the medication with milk to prevent stomach upset. Answer. Complete the entire course of antibiotics, increase fluid intake, especially water, report any allergic reactions or severe side effects. This question assesses essential client education for antibiotic therapy, specifically for a urinary tract infection, UTI. The key phrase prescribed antibiotics highlights the need for adherence to prevent recurrence and resistance. It is crucial to complete the entire course of antibiotics, even if symptoms improve, to ensure eradication of the infection and prevent antibiotic resistance. Increasing fluid intake, especially water, helps flush bacteria from the urinary tract. Reporting allergic reactions or severe side effects is vital for client safety. Stopping antibiotics early can lead to recurrence. Cranberry products can be helpful for prevention and can generally be continued with antibiotics. Taking antibiotics with milk can sometimes interfere with absorption, e.g., tetracyclines, and is not a universal recommendation. Specific instructions should be followed. Focus on adherence, hydration, and safety. Question 45. The nurse is assessing a client with a suspected pulmonary embolism, PE. Which clinical manifestations should the nurse expect to find? Select all that apply. A. Sudden onset dyspnea. B. Bradycardia. C. Pleuritic chest pain. D. Hemoptysis. E. Unilateral leg swelling. F. Hypertension. Answer. Sudden onset dyspnea, pleuritic chest pain, hemoptysis, unilateral leg swelling. This question tests the nurse's ability to recognize the critical signs and symptoms of a pulmonary embolism, PE, a life-threatening condition caused by a blood clot in the lung arteries. The keywords pulmonary embolism indicate sudden obstruction of pulmonary blood flow. Sudden onset dyspnea, shortness of breath, is the most common symptom. Pleuritic chest pain, sharp, worsens with breathing, and hemoptysis, coughing up blood are also classic signs. Unilateral leg swelling, e.g., in the caliph, suggests a deep vein thrombosis, DVT, which is a common source of PE. Tachycardia, not bradycardia, is typically seen, and hypertension is not a primary symptom. Hypotension can occur in massive PE. Focus on sudden respiratory distress, chest pain, and potential DVT signs. Question 46. A nurse is providing education on wound care to a client being discharged with a surgical incision. Which instructions are appropriate? Select all that apply. A. Change the dressing daily or as instructed. B. Keep the wound dry and clean. C. Report signs of infection such as redness, swelling, or purulent drainage. D. Apply a thick layer of antibiotic ointment to the wound twice daily. E. Take a shower and allow water to run directly over the incision. F. Clean the incision with hydrogen peroxide once a day. Answer. Change the dressing daily or as instructed, keep the wound dry and clean, report signs of infection such as redness, swelling, or purulent drainage, take a shower and allow water to run directly over the incision. This question focuses on essential discharge teaching for surgical incision wound care, promoting healing and preventing complications. Surgical incision requires careful handling to prevent infection and facilitate healing. Changing the dressing as instructed, keeping the wound dry and clean, and reporting signs of infection, redness, swelling, purulent drainage, are fundamental for proper healing and early detection of issues. Allowing water to run over the incision in the shower is generally acceptable for many surgical wounds once initial healing has begun, followed by gentle drying. Applying a thick layer of antibiotic ointment without specific orders is usually not recommended and can hinder healing or promote resistance. Cleaning with hydrogen peroxide is not recommended as it can damage healthy tissue. Emphasize gentle care, hygiene, and monitoring for infection. Question 47. The nurse is administering medications to an older adult client. Which age-related physiological changes should the nurse consider that may affect drug metabolism and excretion? Select all that apply. A. Increased renal blood flow. B. Decreased liver size and blood flow. C. Decreased gastric pH. D. Decreased glomerular filtration rate, GFR. E. Increased body fat percentage. F. Increased lean body mass. Answer. Decreased liver size and blood flow, decreased glomerular filtration rate, GFR, increased body fat percentage. This question assesses the nurse's understanding of how age-related physiological changes in older adults impact drug pharmacokinetics, particularly metabolism and excretion. The keywords older adult client and age-related physiological changes point to considerations for medication administration. Decreased liver size and blood flow reduce drug metabolism, leading to prolonged drug effects. A decreased glomerular filtration rate, GFR, reduces kidney function, impairing drug excretion. An increased body fat percentage means lipid-soluble drugs can accumulate, prolonging their half-life. Increased renal blood flow, decreased gastric pH, and increased lean body mass are generally not characteristic age-related changes that negatively impact drug disposition in this context. Always consider start low and go slow with medications in older adults. Question 48. A client is admitted with a severe asthma exacerbation. Which clinical manifestations would the nurse expect to find? Select all that apply. A. Wheezing on inspiration and expiration. B. Bradypnea. C. Use of accessory muscles for breathing. D. Cyanosis. E. Decreased oxygen saturation. F. Pink, frothy sputum. Answer. Wheezing on inspiration and expiration, use of accessory muscles for breathing, cyanosis, decreased oxygen saturation. This question tests the nurse's ability to recognize the critical signs of a severe asthma exacerbation, a life-threatening worsening of asthma symptoms. The keywords severe asthma exacerbation indicate significant airway constriction and respiratory distress. Wheezing on inspiration and expiration is characteristic, due to air moving through narrowed airways. Use of accessory muscles for breathing, e.g., sternocleidomastoid, indicates increased work of breathing. Cyanosis, bluish discoloration, and decreased oxygen saturation are signs of severe hypoxemia. Bradypnea is incorrect. Tachypnea is expected. Pink, frothy sputum is characteristic of pulmonary edema, not asthma. Always prioritize assessing the airway and oxygenation in clients with asthma exacerbations. Question 49. The nurse is caring for a client with a peripherally inserted central catheter, PIC. Which interventions are appropriate for the nurse to include in the plan of care? Select all that apply. A. Flush the PICC line with normal saline before and after medication administration. B. Obtain blood pressure measurements on the arm with the PICC line. C. Assess the insertion site for signs of infection. D. Change the dressing every 24 hours. E. Administer incompatible medications through the same lumen. F. Educate the client to avoid heavy lifting with the arm containing the PICC. Answer. Flush the PICC line with normal saline before and after medication administration. Assess the insertion site for signs of infection. Educate the client to avoid heavy lifting with the arm containing the PICC. This question focuses on the safe and effective care of a client with a peripherally inserted central catheter, PIC, a central venous access device. Flushing the PICC line with normal saline before and after medication administration maintains patency and prevents drug interactions. Assessing the insertion site for signs of infection, redness, swelling, pain, is crucial due to the risk of central line-associated bloodstream infections. Educating the client to avoid heavy lifting on the affected arm prevents damage to the catheter or insertion site. Blood pressure measurements should be avoided on the arm with the PICC line to prevent occlusion or damage. Dressing changes are typically performed weekly or as needed if soiled/loose, not every 24 hours, unless specified by policy for initial dressing. Incompatible medications should never be administered through the same lumen simultaneously. Focus on maintaining patency, preventing infection, and protecting the device. Question 50. A nurse is providing education to a client with new-onset rheumatoid arthritis, RA. Which information should the nurse include? Select all that apply. A. The disease is always acute and short-lived. B. Regular exercise can help maintain joint mobility. C. Periods of rest are important during acute exacerbations. D. Report signs of infection, especially if taking immunosuppressants. E. Heat and cold therapy can help manage pain and stiffness. F. Joint protection techniques should be learned and applied. Answer. Regular exercise can help maintain joint mobility. Periods of rest are important during acute exacerbations. Report signs of infection, especially if taking immunosuppressants. Heat and cold therapy can help manage pain and stiffness. Joint protection techniques should be learned and applied. This question focuses on comprehensive client education for new-onset rheumatoid arthritis, RA, a chronic autoimmune disease causing joint inflammation. New-onset rheumatoid arthritis implies the need for foundational education on managing a lifelong condition. Regular, gentle exercise helps maintain joint mobility and strength, but it should be balanced with rest during acute flare-ups to prevent further inflammation. Reporting signs of infection is crucial, especially if taking immunosuppressant medications that increase infection risk. Heat and cold therapy are effective non-pharmacological methods for pain and stiffness management. Learning and applying joint protection techniques helps minimize stress on inflamed joints. RA is a chronic, often progressive disease, not acute and short-lived. Emphasize a holistic approach involving exercise, rest, medication adherence, and self-care strategies.